Welcome! This presentation aims to raise awareness about diabetes in Asian Americans. This is a collaborative project between the Diabetes Coalition of California and California State University East Bay Nursing Department.
How does diabetes affect Asian Americans? Currently, 1 in 11 Asian Americans has diabetes, and more than half of Asian Americans with diabetes or prediabetes remain undiagnosed. In the United States, Filipinos have the highest rate of diabetes, followed by Japanese, Korean, South Asians, Chinese, and Vietnamese. To understand how diabetes may affect you, you must first understand the disease. Diabetes is a condition in which there are high sugar levels in the blood. You may ask yourself how sugar gets into the blood. Well, when we eat foods such as rice, noodles, breads, or fruit, these foods turn into sugar when they are digested by our bodies. If we consume too many of these foods, our body is not able to use the hormone insulin properly, which is responsible for converting blood sugar into energy for our body. Without the proper use of insulin, sugar from the foods that we eat remain in our blood and can cause damage to our blood vessels and organs, even leading to further health conditions.
Some people have blood sugar levels that are higher than normal but is not yet considered diabetes. This condition is called prediabetes. In the United States, more than 1 out of 3 people have prediabetes, and about 9 out of 10 are not even aware that they have it. Diagnosis of the condition can be identified through blood tests that are performed at your clinic or doctor's office. Prediabetes should be taken seriously because it can progress to type 2 diabetes. It also increases our risk for developing other health conditions such as heart disease, stroke, and nerve damage. If diagnosed with prediabetes, fear not, because this condition is reversible, and the onset of diabetes can still be prevented at this stage.
There are many factors that may put you at risk for developing diabetes. Such factors include physical inactivity, having a family history of diabetes, increased age, high blood pressure, high cholesterol, and smoking. Ethnicity also plays an important role in developing diabetes, in which Asian Americans are considered a high risk ethnicity. Asian Americans are also at risk for developing diabetes at a lower BMI than other ethnicities. BMI is a simple measurement of someone's weight compared to their height. This is particularly important since many Asian Americans may not appear to be overweight, yet they still may be at risk for developing diabetes.
What exactly is BMI? BMI stands for Body Mass Index. It can be used to determine weight categories such as underweight, healthy weight, overweight, or obese. It is calculated by weight in pounds divided by the square of height in inches multiplied by 703. BMI is a screening tool utilized by healthcare providers to determine possible health risks. On that note, you may be wondering, how is BMI related to diabetes? Well, our BMI changes depending on our weight. Increase in body weight or excess weight and obesity have proven to be a major contributing factor to diabetes. Studies have shown that people in the obese category, regardless of gender, were consistently at greater risk for developing diabetes complications as much as 168%.
You can calculate your BMI very easily using a simple BMI table. This particular table is designed specifically for Asian Americans using height and weight. The orange numbers indicate obese BMIs. The yellow numbers indicate overweight BMIs. The green numbers indicate healthy weight BMIs, and the blue numbers indicate underweight BMIs. You can find your height in inches on the left side of the table and your weight in pounds on the top of the table. Where these numbers intersect indicates your BMI. For example, I am 5 feet 6 inches tall and 140 pounds in weight. giving me a BMI of 22.6 in the healthy weight section of the graph. You can also calculate your BMI using the simple equation on the previous page.
The Asian BMI is 23. This is the number to keep in mind to get checked by our doctors and live healthier. The general rule for some time has been that if you have a body mass index below 25, you aren't at risk for diabetes. Research on Asian Americans, however, proves different. The American Diabetes Association, National Institutes of Health, and the Centers for Disease Control have all recently acknowledged that Asian Americans should be screened for diabetes at a lower body mass index, and that number is 23.
There is still time to prevent diabetes. It is recommended that you get screened by your doctor if you are Asian American and have a BMI of 23 or greater and any additional risk factor. You can also help prevent the onset of diabetes by staying active, eating a well-balanced diet, and managing your weight and BMI. Through these simple steps, it is possible to prevent diabetes and live a healthy life.
If you think you may be at risk for developing diabetes or prediabetes, talk to your doctor about getting screened. Diabetes continues to rise in alarming proportions. With early diagnosis and treatment, we can help prevent damaging complications and lower healthcare costs. By screening at 23, we can help uncover thousands of Asian Americans who may be at risk. For more information on how you can prevent diabetes, please visit screenat23.org or diabetescoalitionofcalifornia.org. Let us all take positive steps in overcoming the emerging threat of diabetes.